I'm Dr. Niedbalski from Northwest Hair Restoration. Today's topic is about how to prepare for your hair restoration procedure. Now, we're going to talk specifically about a surgery and not just an A-cell injection. So for hair restoration surgery, a couple considerations are very important. Probably the two most important are going to be how much time you need to take off of work, and number two is confidentiality. In other words, it ties into the first one. When is it going to be okay to go back to work and feel comfortable in terms of your visibility, and if you're concerned about other people being able to see that you've had a procedure done or not. So as far as the healing time goes, it takes about 7 to 10 days after a hair restoration procedure for the recipient area where the grafts are to start to look more normal again. Now that means that the crusts and on the grafts, the little scabs that form, will start to come off in about 5 to 7 days, and they're pretty much all lifted off within 7 to 10 days. The other consideration then is what type of work you do. So if you're in a real physical job, for instance, you're doing a lot of lifting and so forth, it's really important not to do anything like that for the first 5 to 7 days after your procedures. If you work from home, great. A lot of people do work from home in terms of sitting at their computer and so forth, or maybe they're on the phone or both, and those are perfectly fine. There's no reason why you can't do that within a day or two after having your procedure done. The only consideration would be if you're taking pain medication, you don't want to conduct any business at the same time. But going back to work even after a week or 10 days is important. If you're in a high visibility position, or even if you're just in an office environment and you're concerned about and self-conscious about the fact that you've had a hair restoration procedure done and don't particularly want to discuss it with anybody, how is that going to look to other people? Well, in some cases that's going to be pretty easy to camouflage depending on where the procedure is done, in other words, where the hair goes, how much hair you have on your head to begin with. So that's something that I would talk with you about as the patient prior to the procedure, so we can help you understand what you need to do to make that optimal for you. In some cases you just can't camouflage or hide it, and it may be evident to some people, and so that's a consideration, and some people will decide to do this when they have maybe an extended period of time to take off, maybe 2 or 3 weeks if that's possible. So all these things will come into the conversation that I have with you as the patient, because we want to know what your expectations are as far as confidentiality and your understanding of how the procedure is going to go. What sort of things do you need to do to prepare to recover from this procedure in an uneventful way, and one that certainly is going to be easy for you. We invite you to ask us any additional questions for information if you would like. You can contact us at northwesthair.com. This is Dr. Niedbalski, and thanks a lot for listening.